What excites you most on how public health consulting is evolving on a global scale?
It excites me that it's gone beyond pandemic response or COVID, right? I think obviously the pandemic was, there's a silver lining in that it really showcased how much we need to be able to leverage different types of systems within all of our different localities. But it's not just about, oh, this pathogen or this pathogen. It goes bigger than that. So if you take even any war, any conflict, that's a public health crisis. Anytime we have climate change where water sources are shifting, and natural disasters or extreme weather events in different parts of the world are happening, those are all public health crises, right? And the reality is that in order to be able to learn from each one of these, we have to be able to be working, across and abroad. And so, for instance, what happens maybe in California with the wildfire? Well, what else could Colorado learn from that, or Australia learn from that? And vice versa, when there's a big wildfire in Australia or in the Midwest, right? Like, we have to be able to take those lessons learned and talk with each other about how do we handle that? How can we make it better? How can we make more robust systems? How can we make different response systems better? Same thing with different regions of the world that handle earthquakes, right? And whether you are a high income country like the US, or you are a low resourced country that is trying to deal with a response, understanding what is helped to be preventative and understanding how to be able to work together to be able to set up better systems and to be able to set up responses, um, that that is something that is going to be an ongoing piece with public health. And so I'm glad that we're past the point of people just thinking, oh, public health is COVID people. Like, no, no, no. We do so much more than COVID. And we have been doing so much more. It's like, oh, because you went to a restaurant the other day and you didn't get food poisoning, that was public health. Like, oh, you drank water today, that was public health because it was healthy water, right? Having a safe birth or option for healthcare, that is public health. Like, it's not just one little pathogen. It's multiple different things. And I think that people are starting to see that.
So you continued on to pursue your Doctor of Public Health at the Medical College of Wisconsin. What inspired you to pursue a DrPH with a global health and infectious disease focus?
So I went back to school when I left. When I left the state and joined consulting, I realized that I wanted to be able to codify some of my experiences in my career, and it was better late than never. And it was one of those things where when I decided not to go to medical school, when I was 21 and I shifted my, bachelor's degree, it was one of those things where I was like, but I got to go back. I got to go back at some point. And so the flexibility of consulting allowed me that ability to go back to a hybrid program. Sorry, I have a cat, but
we love the cats. Don't worry.
put that out. This is one of my loves is cats. Um, what was I going to say? Oh, so I wanted to go back to school, and consulting gives you that ability to be flexible because sometimes if I'm working on a different time zone with a client, then I have a set of time that I can dedicate towards school. And so it allowed for that flexibility, which I appreciated. Um, but I wanted to go back. I've always had a love for infectious disease, even when I was a cell bio major back in the day when, 20 years prior. I've always been fascinated by that. And so I wanted to study infectious disease, but also wanted to study it on a global level because I know that infectious disease is it's a global health issue. But then I also wanted to study how do you actually impact proper policies that are going to actually reduce healthcare acquired infections. And so that's what I focused on in Uganda. And I finished that last year. And it's been a fantastic journey. I'm so glad I went back, even though I was by far the oldest in my cohort of students. But they all embraced me as a geriatric student, fellow student of theirs. And we had a lot of fun with it.
How has your doctorate work complemented your leadership roles in health systems and diplomacy?
Because I chose to do a global health dissertation and focus on infectious disease globally, it definitely dovetailed into my work as I'm doing U.S. diplomacy for the Department of State through my role as vice chair for the World Trade Center. Because when I went over there, even in Uganda, what was so fascinating, I literally had to interview a district health officer, and a district health officer over there would be the equivalent of a state health officer here. And the only way that I was going to be able to do this interview is he had to go broker a meeting, a negotiation meeting with a fellow district on the other side of the jungle, the impenetrable forest. And he said, well, we can either take a 4.5 hour drive through, the muddy roads, or we can do a 2.5 hour hike through the jungle to do this meeting on the other side. I thought, wow, this is going to be the wildest way I've ever gotten to a public health meeting. So we hiked through the jungle for 2.5 hours. We hiked 6 miles there and then another 6 miles back. So it was 12 miles in a day. And I think the elevation change was somewhere around something crazy, almost 1,000 feet. Like it was a nut. But while we're on this hike, and we're talking about their health systems, their public health systems, and all of their issues from supply chain to policy to the World Health Organization, all of these things. It comes up that he says, "Oh, I went on a delegation to the U.S. once under the Department of State," and I was like, is this the IVLB program, which is the International Visitor Leadership Program? Sure enough, he was one of those leaders who had been sent abroad for the work that I currently do, where I'm meeting with different emerging leaders from around the world. And it had a lasting impact on him for life, on how he viewed healthcare and how he viewed America, how he viewed different ways to connect globally. And so these programs that we do with diplomacy, what we call soft diplomacy, it's people to people diplomacy. The beauty of it is that it affects and impacts people's vantage point of America as a partner for decades. And that's something I don't want us to lose, that no matter what happens with our heads of state that we have at all of our different countries, that the people of each country continue to communicate and connect as fellow leaders on topical areas of joint interest.